My group is looking at trying to predict whether women will respond to neoadjuvant chemotherapy. So that's chemotherapy prior to surgery, because we're not just using it now for inoperable cancers, but we're using it for cancers to try and shrink it down so there's less surgery, which is great if it shrinks down, but in the small percentage where it doesn't shrink down, it's a bit of a waste of time. So what we're trying to do is try to say, are there any biopsy or imaging parameters that tell us whether a tumour is going to respond? And particularly my interest is with shear wave elastography, which is an ultrasound test, and it looks at the stiffness of the stroma around the cancer. And we know that tumour-stromal interactions are important in response to therapy. And we're finding out that, in a general rule, that stiff cancers respond less well than softer cancers. It's not a powerful enough tool on its own, but we're trying to combine it with other features. So eventually we'll be able to tell a woman who's trying to decide, shall I have chemo up front or shall I have surgery up front? We can say your chance of responding to the chemotherapy is X%. And at least that would allow a woman to have a more informed choice as to her treatment options. Because the treatment options used to be quite simple, but now they're very complicated. And I think if they're complicated and we can't give people sort of rough ideas of what the success rate is going to be, then it means that decision-making can be quite stressful, and we're hoping that by giving women the additional information that their decision-making can be more informed and hopefully less stressful.